Hi, I'm Ashley and I'm part of the Sim crew. And today we're going to do a room and simulator review for the upcoming Sim, Stella. We're going to review the simulator, the room contents, and give you a basic understanding of the equipment and your expectations for the day that you come to the Sim Lab. First up is the simulator. So this simulator, her simulator name is Vicky, but for your scenario, her name is going to be Stella. And she was brought in today by ambulance and is waiting to be admitted. So some things about the simulator: her eyes open and shut. You can see her blinking throughout the video. She also has tracking eyes. So if you get close to one side of her, her eyes will follow you. So don't be alarmed if you see that. She does not have the capability of showing colors or lights on her face to like indicate cyanosis or anything. So if you wanted to know that in your scenario, you would just say, Sim question, do I see any signs of cyanosis? And we would be able to tell you what you would see. She has chest rise with breathing as well as lung sounds. And she also has a respiratory rate that you can listen and count using your stethoscope. Be mindful that she is a birthing simulator, so if you look here, this is just a hard piece of metal abdomen, so you're not going to want to put your stethoscope on there to listen to lung sounds. When you're listening to lung sounds, we have found that the best places are on the sides of her chest. Obviously, you wouldn't want to listen over clothing, but you will hear the lung sounds the best there. Let's see. When you listen to the anterior lobes, if you wanted to hear posterior lung sounds, you would just say, Sim question, what are the posterior lung sounds? And we will tell you. Let's go ahead and get a vitals cart, and then I'll show you the rest of the vitals. So the vitals cart is over here, and it's on wheels, so you can bring it with you. And just remember, whenever you're going to touch the simulator, you're always going to want to put gloves on, and I'll show you where the gloves are a little bit later. So, if you wanted to get the heart rate off of this simulator, you're going to go through all your cardiac landmarks. I want to hear you thinking out loud of how you're going to get to that apical heart tone. And if I just show you here, it's kind of hard to see on the camera, but she does have a heart right here. You can see it. Yes, so right here is a heart. So that's where you're going to want to put your stethoscope. Right here, and that's where you're going to be able to hear those heart tones the best. It's not cheating though if you want to palpate for her radial pulse and then also listen to make sure that what you're hearing and what you're feeling match. In order to get her other vital signs, you will just go through your vital sign cart here. So you will put the blood pressure cuff on her arm. Sim question, what is my blood pressure? And we will tell you. Someone is going to document for you on this whiteboard right here all of your vitals and any of your assessment information so that we can see what's being documented back behind the glass. So then we got our blood pressure, we got our heart rate, we got our lung sound, so we're going to use our pulse oximeter here. Put it on her finger. All right, Stella, you're just going to feel this on your finger. Sim question, what is my SpO2? And then we will tell you. If you wanted a blood glucose, it is out of the pack, but normally it will be in this little case. You don't have to take it out. It'll be zipped up. You'll just hold it up next to your simulator and say, Sim question, what is my blood glucose? And we will tell you. Again, it's going to be documented on this whiteboard right here so that everybody in your group can see it. Did I miss anything? We got SpO2, blood pressure. Oh, temperature. Again, nothing goes in the simulator's mouth, so you will just take this out. Sim question, what is my temperature? We'll give it to you. I think that is all of the vitals. And then you also want to ask about pain. There is a pain scale over on the side here. Her is the pain assessment tool, so you can always ask your patient that pain question, and you always want to go into depth as well. Where is the pain? Does it radiate? How severe? What does it feel like? All those questions are appropriate. Okay. This simulator, I would consider it with the vital signs. Over here there is belts. Yep. So you will actually put these on the simulator, and you can just verbalize where the monitor or like the probe part would go on the abdomen. So when you take this, you would take this off. You can actually put this on her. And if you want to know more information about that, we have a video called Toco Monitor with Patty, and it goes into more detail about that. But now that I have all my vitals taken, I have the monitor straps on, I can flip up the cover of the monitor here. And now my vitals are displayed, and I can see baby's heart rate and contractions on there. Okay. When you're doing the head-to-toe assessment, it's important to ask sim staff for specifics. For example, if you want to know if Stella has palpable pulses, this simulator has carotid, brachial, and radial pulses that you can palpate. If you're assessing her skin, similar to what we said with like the lights, but let's say you see her IV here and you want to know if it is like looking any signs of concern, all you have to do is say, do I see any redness? Do I see any ecchymosis? But we don't want to hear you say the IV looks good, because we don't know what that means. Talking about her IV, it is here in her left arm. She has another part to it. This little bag here is an IV drain bag, not in play. So it just means this is not a Foley for her. It looks like a Foley bag because it is a Foley bag, but it's not for that purpose. It is simply to collect the fluid that you would put through an IV. So don't mess with that, but you will actually be able to flush, push, hook up all of your IV stuff. I just gotta make sure I'm on track here. When you are looking at the IV, if you can see, there we go. When you are looking at the IV, you're gonna wanna assess the site, follow those lines all the way up, make sure that your rate is correct, make sure the bag that you have hanging is correct. If this rate was incorrect, because we are assuming this IV pump is on and running at 999 mLs an hour, if that's incorrect and we needed to stop the pump, all we would have to do is remove the sticker. Now the pump is off. If we wanted to change the rate, you would simply just erase the dry erase that's on there, write your new rate, and stick it back on, and then it would be running at that rate. Okay. I think that's it about the IV. Like I said, you will spike the IV bag, you will hook it all up, you will run all those fluids because there is a bag to catch it. We're gonna come on over, actually before we go over there again, this simulator is wearing a task trainer right here. It is an IM task trainer. If your patient requires any IM medications, you will just inject into here. Not into the simulator, but into the task trainer itself. Okay. The bed, please talk to the simulator when you're speaking to your patient. It's important to pay attention to what the patient says to you because it is a script, and we will give you clues if we can to help get you, prompt you to do assessments or interventions. You are allowed to move the bed up and down as needed. Just be mindful, she has 2 cords, one to keep her running and one plugged into the wall, so just be mindful that you don't pull any of those cords out. We're gonna go to the other side of the bed here. And behind the monitor, she has a functioning head wall. So medical air, suction, and oxygen all work. We want you to turn it on. We want you to hook it up. We want you to put all those interventions onto her if it's needed by the doctor's orders. Remember, if you needed to administer a nebulizer for any reason, you will hook it all up, but you just won't put that liquid in the cup. Okay. Because this is a birthing simulator, she does make some extra noises. Once that baby is born, the baby that is going to be delivered is a birthing baby. That baby is just going to go up onto mom's chest, and we're going to pretend that mom fell asleep. I know in normal life you would stay with mom and someone else would go with the baby, but for sim purposes, we have to kind of split it up so that we don't have everyone talking at the same time. So once the baby is born, that baby goes up onto mom's chest, and we will come out, one of the sim staff will come out with a different simulator for you to assess and do your newborn assessment. So I'm gonna have you follow me over to the baby warmer so we can assess that simulator. Perfect. So this simulator, trying out different angles here. This simulator's name is Supertory. Oh, we are real close.
Sorry.
No, that's okay. This simulator's name is Supertory, but for your sim, it will be Baby Girl Sim. When you get over here, as soon as the baby nurse catches the baby, and I will assign that role to you the day of the sim, you will just be standing here ready. That baby will receive, that nurse will receive the baby, and then someone is going to be responsible for hitting the APGAR button. When that time comes, you will just turn this button, you will start this button. You will hit the button, oh my goodness. If you get excited and you happen to hit it too early, you can just hit stop, reset, and it goes away. And then you can hit it again, and that will just tell you when to do your 1-minute APGAR and when to do your 5-minute APGAR. Because I will have this warmer all turned on and set up for you, it will beep throughout your scenario. If you are like me and get a little bothered by that, you just hit this silence button right here and it will turn it off. I don't want you to turn the whole warmer off because then it will be harder for you to hit that APGAR button when it's time. So if it gets too annoying, just hit the silence button. Okay? We'll just turn it off right now so that we don't affect the baby. So like I said, this simulator's name is Supertory, but during your sim, it's going to be Baby Girl Sims. She is able to blink, make facial changes. She has a bunch of different colors that she can show. Blue to simulate cyanosis, yellow to simulate jaundice, red to simulate fever, white to simulate pale. And she's also able to grunt and cry, and she can move all of her limbs. So when you are assessing this baby, assume what you're seeing is correct. If she's supposed to be moving, she will be moving. If she's not moving, she's not supposed to be moving. Just be mindful, you are allowed to pick up the baby in the simulator, but because she has those moving body parts, we don't want any of those to get broken, so never restrict any of her body parts that are moving. In the case that she's moving and you wanted to pick her up and look at her backside, you would just say, sim question, can you turn off the movement so I can assess the baby? We will turn off the movements and then you are free to pick up the baby to assess further. Typically, nothing will go in any of the simulator's mouths. However, you are allowed to put the bulb syringe in the baby's mouth. That is okay. There is a task trainer here for any injections. And just remember, you will actually give injections in your scenario, so just be mindful of your needle safety. I will go over where the sharps container is in just a second. You, again, will always wear gloves when you're touching the simulators, just to maintain their skin health. So be mindful of that. And just say sim question if you need any other assistance from the sim staff. The famous sim question is, do you actually want me to do this? And the famous sim answer is yes. The only things that you will not do is typically put anything in the simulator's mouth, or like put that liquid nebulizer medication in the cup. But most everything else you will actually do. Okay, I think that's enough about the specifics on the simulators. So now we're gonna do a little bit of a room review. Since Stella was brought in by ambulance and is waiting to be admitted, she's in a multifunctioning patient room. So we're gonna show you where the med room is right now. Okay. So over here we have a table set up with some, are they partitions?
Yep.
Boards. So we have created your own little med room area. In the med room, you will have gloves, supplies, equipment, meds, all of it, but you're still in the patient's room. The time of your stage or shift will be on the simulated clock right over there. So you can see it from the med room and from other parts of the scenario. And then here is that sharps container that I was talking about earlier. It's right here in the med room. We take your safety and your classmate safety very seriously around here. So as soon as you give an injection, make sure you put the sharps right into the sharps container. Your gloves are available here on the table. And I forgot to mention this earlier, but Stella or Vicky has real bodily fluids that we load into her. So you're going to want to wear gloves just to protect yourself and your clothing. So there's gloves and hand sanitizer here in like the med room on the table. You do not have to remove and change your gloves over and over. If they do get soiled for some reason because of the bodily fluids that we have, you're more than welcome to change them. But in the event that they're not soiled, you can go ahead and just say, I would wash my hands and change my gloves, but you can keep them on. Once you look at this table and you find your meds, you have meds for your specific patients in these little tackle boxes, but you also have IV medications laid out here for you on the table. Once you have decided what you're going to give and you're ready to do a med check, I'm going to have you stand right here at the cart because it's positioned right underneath of a microphone. I think you can see it. Yep, wiggling. Kristy did that in another video, so I had to do it too. So make sure that you pause sim for a med check. I will typically announce that overhead. Pause sim for a med check. Everybody else in the room can continue to do things quietly. We just can't have a bunch of people talking at the same time as a med check is going on. So you'll do your first 2 med checks here, and then when you're ready, you can take this whole cart that's on wheels into the patient's bedside and complete your 3rd med check at the bedside. We already talked about the meds being there on the table and in the cart, but once you've given like a pill medication, you will put, or a syringe I guess, you will put it into this white basket here so that we can verify the dosage that you gave. So that takes me to this table here. There are drug books, 2 for pills, 1 for IV meds, and then you have an assortment of other resources of papers on these clipboards. You are welcome to take the clipboards with the papers and use them wherever you need, but we just ask that you use pencil or dry erase marker only because no pens are ever allowed in the sim lab. You also have a little weighing station over here if you needed to weigh something for like blood loss assessment or something like that. Okay, we got all of that. So we're gonna go back to the med room here. In the event that you need to make a phone call, again, because this microphone is positioned right here, I would love it if you would make any phone calls standing right here. So for Sim, you would just say, Sim question, I'd like to call Dr. XYZ. Typically, switchboard will answer. You will say the doctor's name again, and then we will put you through to the doctor. Again, when you're doing a phone call, just make sure that everyone else in the room is being quiet so that we can hear what's going on with the phone call. For Stella, there's going to be 4 stages in the sim, and I will go through the day of what roles that you have, but we will have half of the group be mom nurses, half of the group will be baby nurses, and then we will switch those roles for stages 3 and 4. You will be allowed breaks between all of your stages, and there will be a 30-minute lunch break during the day as well. Just make sure that you're back in the conference room for debrief at the communicated time. We do have your patient's chart. Since you have 2 patients, there's 2 patients' charts here on the med cart, as well as MARs for both of your patients. And there are separate videos going over the patient's chart and MAR and TAR forms that Kristy has made, so go ahead and review that so you know how to document appropriately. After you come back from lunch, we will run through a debrief session that is required following all simulations. It will give you time to reflect with your peers, instructor, and sim staff, and then you will complete the required survey. The survey is anonymous, so your voice is, and your voice, oh my gosh, and is your voice for simulation efforts. It is important to note that you must be on time for your simulations. If you are more than 5 minutes late and you have not contacted your instructor, you will be asked to leave. If you are rude or disrespectful to your peers, instructors, or sim staff, you will also be asked to leave. Please review the student behavior form that is in your student sim lab handbook and in the conference rooms to understand the indications for student remediation or removal from the simulation experience. I think that is all. So we hope that this video is helpful in preparing you for your Stella Sims scenario. And we will not review the room or equipment on the sim day unless there are changes to discuss. If you have any questions or concerns, you can always feel free to reach out to Kristy or myself via email. And that's where we're at.